Well, a very good afternoon to everyone. Apologies for the delays, but we understood that one or two people were still en route, delayed for various reasons, but we really ought to make a start. So a very warm welcome to you all, and thank you for turning up, and to the Medway Council meeting of the Health and Wellbeing Board being held today, 17th of November 2022. Apologies for absence have been received from Councillors Howard Doe, Galvin, Tranter. We have apologies from Paul Bentley, but I understand Paul is being represented today by Vincent Badu. So Vincent, a warm welcome to you, please. Jackie Brown, Assistant Director, Adult Services, Margaret Kane, Healthwatch Medway, and Donna Marriott, Assistant Director, Children's Services. With respect to invited attendees, we have received apologies from Cherise Gibson, Jane Black, Chris Giles, and David Whiting. Are there any other apologies that Vince, please?
Just to firstly recognise it's the first meeting I've ever been in where there's a majority of Vincents. May that long continue. Apologies, I will have to step out for about 15 minutes, around about 3:45, so I will be stepping out and stepping back in. But yeah, pleased to be here.
Well, not to be outdone, David Whiting is not here today, but he's been substituted by his namesake, David James Williams. Sorry, but nice to see you. Thank you. Right. Is the record of the meeting held on the 1st of September correct, please? Are we happy? Yeah, happy. I can sign the minutes. Good. Thank you very much. There are no urgent matters. Item 4 is declaration of disclosable pecuniary interests and other significant interests. Are there any interests to be declared, please? No? Good. Thank you very much. Right, we now go on to the main business of the meeting. And as usual, may I ask those introducing reports to keep their introductions to a maximum of 5 minutes, please. Item 5, Medway and Swale Health and Care Partnership Community Diagnostics Centres briefing report, and that can be found on pages 21 to 130, please. And that's to be presented by Nikki, is that correct?
It is, thank you very much.
Thank you, Nikki. The floor is yours. Thank you.
Thank you. So I'm going to obviously take the report as read. This is really good news for the Medway system. So we were successful in October in getting a bid to build a community diagnostics centre, which comprises of a hub and spoke model. We used the Medway public health team to do our strategic planning because there's a lot of criteria about where the hub and spoke sit, and they have to be based around health inequalities, because the whole purpose of this is to sort of support recovery of elective services following the pandemic, but also to support communities that can't access healthcare and improve their clinical outcomes. So the hub is going in Sheppey, because that's where the highest inequality within our area is, and the spoke is going at Rochester Healthy Living Centre. Now, there's not a lot of difference between a hub and a spoke in name only. We've actually got to put more diagnostics into Sheppey that aren't necessarily needed because that's the criteria of the national guidance. So there are some diagnostics that we're putting out there that we won't be utilising to their full capacity because we don't need them. The beauty of the spoke in Rochester is that we can design the spoke to meet the needs of Rochester and the needs of Medway in its entirety. So all the diagnostics that are going into the Rochester Healthy Living Centre have been capacity planned and based on activity and based on need for that population. It's going to have everything from MRI and CT right the way through to some of the lower modality diagnostics such as echocardiograms and ECGs and Dopplers. We've got the architects on site at the moment. We're in the planning phases. We plan to have CT activity over in the centre just after Christmas. And then the building work and the reconfiguration of the void space will start in April next year with with a phased opening from late autumn next year. So, yeah, any questions?
Thank you very much for that, Nikki. It really is, in my view, it's good to have a good news story being presented and to open our meeting. Vince, would you like to say something, please?
Yeah, thanks very much. And thanks, Nikki. It's great to hear you twice in a week. And I'm very pleased to hear your presentation at the MVA AGM. A few more acronyms in there. I guess I've got two quick questions. One is around the impact on the existing services at Rochester Healthy Living Centre. Obviously, that is a well-used place, not least it was a hub for COVID vaccinations. So just to get an understanding, a bit more detail as to what might change from what's existing currently. And secondly, I couldn't have this item but not just ask for a brief update on Chatham's Healthy Living Centre, because of course it would make sense, probably if we were further slightly down the line in the process, to have just built it in. If you think about transport links, actually they're not bound to the Dells, but they're a lot better to the centre of Chatham. So just a brief update on that if you're in a position to give that, and whether that was considered in this process. Obviously Rainham and Lordwood of course would have been, but whether the Chatham hub, Healthy Living Centre, call it what you will, whether that was considered as part of this process. Thank you.
So on your first point around impact, we're not taking any services out of Rochester Healthy Living Centre. We're repurposing void space for the building work. The CT will be external to the building, and that will be going in the current car park, but we're repurposing the car park that's behind the building, where staff will be, obviously we're working with planning teams in relation to lighting and things, because I know that's been an issue in the past. So nothing is coming out of Rochester Healthy Living Centre, it's building work to repurpose the space. Absolutely, if we could have put this in Chatham, that would have been the ideal place to put this spoke. Unfortunately, the NHS England guidance and timelines didn't tie in and don't tie in with the delivery of a healthy living centre within Chatham. What the plans are, if and when Chatham ever materialises, and I know that's up in the air still at the moment, is that we will be building diagnostics in as a matter of course. So in Chatham, and obviously proposals for who later on, if they come to fruition, we would automatically put diagnostics in as a matter of course and have further spokes.
Just to come back on that, I know Leanne will want to comment on that. So, I mean, I absolutely welcome the fact that obviously this is additional capacity in Medway, and certainly, you know, for people in Rainham, for example, they may choose to actually go to the hub rather than the spoke, and actually the system probably allows for that more than it would have done. I'm always slightly nervous when people are not 100% confirmed that Chatham will have a healthy living centre. That does give me cause for concern, and that's not your fault at all, Nikki. That's just, we've had a process which has been, a site was found close to a decade ago in Clover Street. That was never built out. We've now got the, I don't know if it's still a secret, but I'll say the Pentagon. I think if it is a secret, it's the worst kept secret in local government and in Medway. But I'm just, yeah, the fact that we don't have a timetable for delivery of it, as a Chatham councillor and someone who has got lots of residents who would benefit, and people have heard me talk, you heard me talk early in the week around my eight-year journey. I want to get that number down. And one way we do that is access to good services. So that gives me cause for concern, but that's a frustration which hopefully will be brought to an end soon. Thank you.
Thank you, Vince. If it's any consolation to you that if you speak with Councillor Rodney Chambers, one of our former leader of Medway Council, he will tell you of the days when the new Medway Hospital was due to be constructed on what is now the business park in Gillingham. So the way things change, it's of no surprise. So let's wait and see. But I think this, well, I'll speak about this in a moment. But Leanne, you wanted to speak, please.
Yeah, thanks, Nikki, and, really good news. I just had a question about how Medway's children and young people would benefit from this. I noticed there was a lot of statistics in here about children, self-harm, etc., but I wondered if you could bring it to life for me about how children and young people in particular might benefit from this, please.
Yeah, so if I use asthma, childhood asthma as an example, nationally we're an outlier for childhood asthma and childhood asthma outcomes. We have more admissions to our acute trust for childhood asthma, and a lot of that is down to the fact that we don't have proper pathways for children with asthma, and we don't have the right diagnostic technology in primary care for children with asthma, and where we do, we don't necessarily have the expertise to facilitate those tests. So one of the pathway plans that we're looking at building into the diagnostics sector is a children asthma diagnosis pathway, where we'll be looking at rolling out sort of an asthma bundle, which gives them an all-round best practice sort of review process, and the diagnostics centre will be crucial to that pathway being developed.
Thank you. Is there anybody else wishes to speak on this matter? Okay, fine. Well, Nikki, thank you very much for presenting the report. As I said at the beginning, I think this is a good news story, and I think the fact that we have one part of the hub which will be on the Isle of Sheppey in Swale, and the other part here in Medway, I think is a very good move forward. And being a diagnostics centre, it has to be to the benefit of Medway Hospital itself, which is in fact, as we know, it's being oversubscribed in so many areas. And this can only really take away some of the areas where people go there for treatment, but before you get treatment, you need diagnostics. So I personally believe that this is going to be an absolute godsend to the hospital. And I'm sure if Jane Black was here, I think she would probably be saying much the same. So I think it's a good report, good news, and I'm happy to, I move that the board supports the plans for the CDC spoke site in Rochester as outlined in the paper. Is that agreed? Agreed. Thank you very much. Right, moving on to item 6 on the agenda. Vincent Badu, our Chief Strategy Officer of the Integrated Care Board and Executive Team, will introduce this item, which is the update on population health management. And that's to be found starting at page 131. Vincent, please, the floor is yours.
Thank you, Chair. This is a brief report just to give an update on the Population Health Management Programme. I know the Health and Wellbeing Board has had an earlier report in the year that describes the programme in totality. And I think what I really wanted to do is perhaps draw on the colleagues who are here around the board as well, who are instrumental in delivering the Population Health Management Programme for Medway and Swale. So we firstly launched the second element of the Action Learning Set programme in July of this year. And in fact, since the first meeting, we've had a follow-up action learning set, which was led and chaired by James Williams, Director of Public Health in Medway, and really brought together a wide cross-section of partners from across the health and care system to really think about how we use the knowledge, information and the tools that are part of the population health management system to help us to further the work that we need to do around addressing and minimising health inequalities across our communities and our population. So as an integrated care board, we are working closely with partners across the system to develop our integrated care strategy, which will really build on our population health management programme and help us to think about how we address those inequalities, particularly in places, but also in neighbourhoods, and really draw on the information we have around disparities in people's health status and think about how we can improve on those, working collaboratively and together. So at this point, this is just an update to tell you that the programme has moved into the next phase. The neighbourhood programme is particularly focusing to start with as a pilot in the Sheppey area. Lots of learning there and engagement, particularly with partners across our primary care networks, the voluntary sector and community sector, but also with our communities around how we use the learning to address inequalities. So I'll stop there and perhaps open to questions from the board.
Perhaps I'll start off with one question, and that is to ask that why was Swale identified as, or how was Swale identified as being the best place for a pilot scheme, given the number of people, if you like, the population is far greater in Medway, and I can think of many areas in Medway that would benefit from being a pilot scheme as opposed to Swale, whilst recognising that Swale is part of the arrangement, and the fact that the people of Swale look at MFT as being their local hospital rather than Maidstone. You mentioned Maidstone, and oh dear me, it's you couldn't you can cut the air with a knife. Such is the feeling. But my question is that why was Swale chosen as opposed to anywhere here in Medway, please?
Thanks, Chair. I'm going to ask Nikki to respond to that question because I think it's really important that we situate this within the local health and care partnership and the work that they're doing on the ground around population health management.
Thank you. And Swale wasn't chosen as the first site. We actually launched our first site in Medway, with Medway Central being our first PCN area. So Swale, Sheppey PCN is the second PCN area to go live. The ALS programme, or the Action Learning Set programme that's described in this paper, is a very small part of what we're doing in relation to population health management in Medway. We're in a really privileged position because we have the expertise of the public health team at Medway, and being a unitary authority, that has actually served in our favour in the fact that we can really get down to the detail and work as a team to identify those areas of inequality. So on the programme that Vincent has described, we started with Medway Central, and we focused on childhood obesity, and we also focused on adults with hypertension and another long-term condition. And then the second area that we started to roll the pilot out is in Sheppey. But in Medway itself, we've got an awful lot of programmes running in relation to population health management that have come from the health inequalities identified through the work from the public health team. And I could go on probably for all day to describe some of those programmes, but if I can just touch on the volunteering and the community resilience. What we decided very early on with our local population health management programme was that nobody understood our communities better than the communities themselves. So we very much wanted to find a way to harness the energy and the resilience of the communities and the voluntary sector that they showed during the pandemic, and use that to do something different and to work collaboratively and collectively going forward. So for the last probably about 18 months, we've been working hand in hand with our voluntary partners, and we've devised what we call a framework that all our organisations have signed off, that we're going to work differently and think differently going forward. And we've now got our voluntary sector on all our boards in the Health and Care Partnership, and we're working hand in hand with them to understand the communities that they're in and the inequalities that their communities are saying they're facing. So not taking what we say, I mean, we use the data, we use the evidence, but we're taking the communities themselves and their perceptions. And we're really working hard to reach the communities that have a voice, but the system isn't set up to hear it. And it's those communities that are really, really valuable in designing some of the interventions that we're putting in place going forward.
Thank you. If I could just come back on one point. What contribution is Kent Public Health making to this programme? You spoke about the work undertaken by the Medway Public Health for Medway. What is happening in Swale relative to the Kent Public Health, please?
So we tend to use, so David Whiting's team tends to be able to pick up some of the Swale bits, but also from a Kent perspective, our Kent colleagues are very much involved in some of the data distribution, some of the analysis, and certainly with some of the programmes that we're rolling out within the Kent footprint, so the Swale footprint, things like childhood obesity and the childhood asthma programme, Kent are very heavily involved in.
No, thank you for that, but I'm sure you probably guess why I'm asking these questions, because Medway has a very limited capacity on public health, and I think it's important that Kent pick up their share of the work and not be reliant upon Medway being the lead on what goes on in Swale. I know we're part of the organisation, but as the portfolio holder also responsible for the public health activity within Medway, I look at the capacity and I recognise that we have limited capacity, and I think that is something that should be picked up by Kent, and we will support, yes, but we're not going to be doing the totality of the work that's involved. Thank you.
Although Vince might want to go.
Thanks very much for the update and obviously the ongoing work. Let me be really frank. I think this is challenging for and I'm speaking on behalf of 55 elected members, a council of 2,000, a population of 285,000. Some of them might disagree with me. By the nature of being lots of them disagree with me all the time, actually, I should probably say that at some point. Being a unitary authority and having had a CCG which was coterminous put us in a position where I think conversations were really easy. The new landscape just makes that a bit more challenging, and I recognise that. And it's not about, for me, it's about trying to get to a point where 11,000 people put me here, of Chatham Central, which is part of Medway Central, of course. But actually, I want everyone in North Kent, I want everyone in Kent, I want everyone in the UK to be healthy, to be healthier. But actually, there are sometimes some challenging conversations. So actually, I would take a contrary view that on something which is Medway and Swale, we are substantially bigger than Swale. Swale is a small but important part of Kent County Council. So actually, there'll be differentials of views on that, I accept, but it's around trying to recognise that actually this wasn't a conversation we were having really 18 months, 2 years ago. And I think for lots of people, not intentionally, that is a bit of a challenge. And I recognise that. So I certainly want to, recognise the good work that James and his team are doing. the work that the Kent colleagues will be doing. Of course, Kent has 2 tiers of authority for this part of the world as well. So that makes some of those conversations difficult and challenging as well, even before you get involved with us. So I just want to say that, because I've not said that anywhere else, and I think it needs saying, because I recognise that Medway corporately, and I mean that in the broadest sense, is, I hate the phrase that we're on a journey, but we are on a journey of this new way of working, and I recognise that. And does that mean that I'll stick up for Chatham Central and Medway? Yeah, actually, because I've been elected by those people to be their voice. So it's right and appropriate to do that. But it's about trying to do that in a way which is recognising, you know, whether we like the landscape or not, Medway and Swale, certainly for however long it is in NHS terms, so it might have changed before we leave the meeting today. I say that for local government as well. That's where we are now. So I welcome the fact that actually, so it's always going to be evidence driven. So you go to the places where the need is the greatest, and that isn't necessarily, and that will be different for different things. So actually, in some senses, I'd want to see some of this work down the line being focused on the peninsula, actually, because and the challenges of the peninsula about service access and the challenges of Swale for service access, they've got far more in common than Waldersade or Chatham, actually. Access for the urban or the suburban areas generally is pretty good. If people choose to access it, that's a different matter. And of course, there are exceptions. We've talked here many times around GP appointments, for example. That's an issue we've talked about here many times. So I recognise we're on this journey. I recognise that actually it sounds as if, rightfully, that the kind of places for pilots are being target-driven by where there is the most need. And that's right and appropriate, because then you'll learn the most from that. So look, continue doing what you're doing, please, because ultimately, post-COVID, and I say this reluctantly, post-COVID, some of the underlying health issues we probably still don't know about yet. And actually what we need to have in place are the systems that will deal with that, whether that's the kind of public health focusing stuff, the important stuff we talked about in a previous item around diagnostics. So yeah, and please keep us informed. And you know, a short but important report like the one we've received today is helpful. So thank you.
Thank you, Vince. You wanted to come in, James?
Just very briefly, just by way of reassurance, I think that comments that we've already heard today around collaboration are really important. There are 2 key points for me. One is around, and Nicky's already said this, the bit where we are working with our NHS partners. We've got a duty under the Healthcare Social Care Act 2012 to provide that support from a public health perspective, and that's a requirement in relation to our grant conditions. But I meet quite frequent with my counterpart in Kent and work like this in terms of whether we're, and if you look at the profiles get delivered by our team, but they are joint and shared. There are, you know, we do this for the whole of the patch, and likewise there are reciprocal arrangements in terms of the way in which we work with our Kent colleagues in terms of all of that. And when it comes down to interventions, I think we can be really clear around how we deliver those, and I think Nicky's just set that out just for reassurance. Where there are specific resources or whatever else that needs to be delivered that are about Medway as a place, then we work out what that is and we ensure that that's provided. And where there may well be boundary issues or it's in Swale, we work through that as well, so that there aren't, generally speaking, any conflicts in terms of that. And one of the things I know we'll come back to it when we see the integrated care strategy. I think that's where we've been able to work quite collaboratively to blend our resources so we can get the best of both worlds. But just in terms of reassurance that there is generally a spirit of collaboration, but actually the resource issues that you've flagged, we manage that, and I manage that quite tightly, and we've got a good relationship with the team doing PHA.
Thank you, James. Anybody else wishes to speak on this subject? Okay. Oh, sorry, Martin. Do beg your pardon.
No, thank you. I suppose just picking up on the comments around the complexity with the organisations, and trying to represent Medway and Swale does bring a range of complexity probably wasn't there previously. But if we orientate this around the citizen or the patient, it's the comments earlier, these patients all flow into Medway Acute. So any service we can provide in Swale has a knock-on benefit to Medway residents. So going back to the population health paper, that's really supported us a number of pieces of work. So all our priorities are working on the back of that. So some of the success with the bid on the Diagnostics Centre is used on the evidence we presented through the population health. So again, putting the hub in Sheppey has a direct impact on Medway Acute in terms of the benefit of resource it frees up there. So it does add a complexity, and trying to balance this through is working with yourselves and with KCC, with HCRG as a community provider. So there is a number of organisations that it was a lot simpler. But the thing that, regardless of the organisation or regardless of the ICB, is the patients will flow into Medway Acute. So all the pathways and the evidence we're trying to use is on that basis to say, actually, where's the biggest impact and the biggest sort of, for the buck, every pound we're putting down, what's the impact we can have on that? Recognising there's equity and there's health need across the whole system. But again, trying to really work on a PCN basis. So those primary care networks are 50,000 populations. There's 9 across Medway and Swale. Trying to build it up to what's pertinent for each of those populations. And that would be different to what's required in Sheppey, to what's required in the Hoop Peninsula, to what's required in Chatham. And that's what we're trying to work. And that the work that Nicky and the team with James and David, trying to use that as evidence to say, okay, this really get a practice by practice build up of what the requirements are. That then can set our priorities and then allocate our resources. So that's the way we're trying to work. But absolutely understand that the sort of the complexity of the system we're operating in. But it is the patient that actually we're trying to impact and make the difference for.
Thank you, Martin, and thank you everyone for the contributions. I raised an issue that obviously was a concern raised by me relative to the capacity to deal with us here in Medway and at the same time share some of that capacity with Swale, given that Swale is very clearly in Kent County Council, over which Medway has zero control. But I feel a little more confident of the fact that Medway Public Health is first and foremost Medway Public Health, but is in fact working in support of Swale specifically, and that is fine by me. But it's something that I'll be watching as a portfolio holder, and I need to watch it very carefully to make sure that if there's any signs of capacity strained or constraints, then James and I will be having that conversation to make sure that that Medway is looked after. Because after all, this is the Medway Health and Wellbeing Board as opposed to the Kent and Medway Health and Wellbeing Board, which no longer exists because STP came to an end and we are where we are today. So thank you for that. Anyway, the recommendations on the report are as laid down on page 132, and that is that the Health and Wellbeing Board is asked to note the update and continue to support the PHM programme, spread and sustain plans. Is that agreed, please? Agreed? Thank you. We now move on to item 7 on the agenda, which is going to be introduced by Dr. Leanne Farage, Director of People for Medway Council, and this will be Children and Young People's Plan.
Thank you, Chair. I'll keep this brief because I fear my voice is going to give up the ghost any minute. But the Children and Young People's Plan is our setting out our partnership vision and our priorities to help young people in Medway. Basically, the Children and Young People's Plan is no longer a statutory requirement, but given that Medway Children's Services is still deemed inadequate by Ofsted, and because we think it is the right thing to do, falling out of Medway Council's priorities, supporting Medway, people to realise their potential, and Medway's people strategy, I'm pleased to say that we have forged ahead with the Children and Young People's Plan. The most important bits there for you to look to note are in the cover report under 3.2 and 3.3. So the vision has been worked on by partners, young people, children, as many as we can. So 3.2 sets out the vision for you. 3.3 are the strategic outcomes, and I'm going to leave it at that, Chair.
Thank you, Leanne. Anyone wish to comment, please? Vincent?
Oh, thank you very much. I only normally get called that by my dad and the tax man. Thank you very much for the work that's going in on this. It's a really important document, and it's important anyway, and it's one of those things which is absolutely right and appropriate that we have it, even though we don't have to. So I think that absolutely should continue. I guess two things really. One would be around making sure all of the voices of young people are part of it. We've got some really good structures in Medway that gets a really good amplification of bits of the 65,000 young people. And I'm fearful we don't hear from the majority of them, because actually those structures are not necessarily for them. So the Youth Council are brilliant, but not everybody is a member of the Youth Council. Not everybody wants to feed into that. So a bit more around that would be helpful, and the role that, whether that's youth services, whether it's schools, whether it's faith groups, whoever can play in making sure that happens. I wasn't sure whether I'd raise this on this item or the next item, but the fact that we've got Mark and Rebecca and yourself here, I wouldn't be doing my job if I didn't say Rochdale, in my view, could have been in Medway. You know, we could have had a dead 2-year-old child because of housing quality in Medway. I would say a subtle and important difference between the tragic case in Rochdale and here, is that I think if it was to be in Medway, it would have been a private sector housing organisation, not a public sector housing organisation. So I wonder if colleagues could give just an overview, a sentence or two on giving the people of Medway confidence that we're doing all that we can to make sure that our young people are safe, that they have a plan for the future, particularly around the issue of inadequate and poor housing, which I know is out there because I've seen it firsthand. I've seen families with 2-year-olds in Medway, and that's not unique to Medway. I think if we're honest, any part of the UK that's got an urban area in particular will struggle not to have some of this. But how can the parents, how can the families of Medway feel confident that we're doing all we can? And I'm sure there'll be some professional lessons learnt very quickly as a result of the coroner's conclusions earlier this week. Thank you, Chair.
Thank you. Mark, would you like to contribute to that?
Yeah, I think just to highlight a couple of things, Chair, if that's okay. And, you know, I agree with Councillor Maple. It's an incredibly sad case. And we know full well that there will be properties in Medway that do suffer from damp and mould and condensation. I think in terms of the council's approach to its own accommodation, we're obviously working very hard to raise awareness amongst tenants around you know, how to heat your home properly, how you access funding to enable you to heat your home properly, which is obviously a very acute issue at the moment. And we're doing lots of work around making sure that that we are picking up a conversation with residents on a regular basis about whether there are any issues in their property that need addressing, such as damp or mould, and it's incredibly important in that case because it was obviously a social home. Private sector is more challenging, and I have to be realistic around that. You know, we have 15,000 homes in the private sector in Medway, and we don't have access into all of them. I suppose the thing that I can say is from the council's perspective, we have invested into our private sector housing team, so we have more bodies in that team than we previously have done, and they're working hard to get into properties where there are issues around disrepair and complaints are being made by residents into the local authority. I think the challenge for us, and something we probably need to do a bit more work on, is raising awareness of what support is out there from the council in respect of damp and condensation and mould in properties, so that people know where to come to, because I think it's the things that we don't know that are probably the challenge for us at the moment, I think.
Thank you, Mark. Leanne, did you want to come back on any of these points, please?
Yeah, I did. Thank you. I think that the child-friendly Medway initiative is going a long way to ensure that a lot of different children and young people's voices are heard. Our work with the schools is certainly focused on getting the voice of all of Medway's children and young people. It's a big ask, but it's one that, you know, you have to work out, and we're committed to working at that, because it's really important we get those diverse views and try and make sure that all our residents are represented, including the younger age range. Just picking up on Mark's point too, I agree. I mean, there are a variety of partners who will work with us. So children's social care may well know of families who are in the private sector who have issues with housing, so we pick it up, we feed back into Mark's part of the business, to James's public health part of the business. So there's more than one way to get to know what's happening with families, and we're very aware that that's what we need to be looking out for.
If I can just come back on that, I'm very grateful for those answers. And look, I agree. I think let's hope this never happens in Medway. My concern and my view, having represented an area which has got in some quarters pretty shocking accommodation at points, is I think it would be far more likely in the private sector housing market than the public sector housing market in Medway. I think so. Our two main providers, one of whom is the council, I think does a pretty good job. I think MHS do a pretty good job. And Mark, you're right to highlight, and I think this is a challenge to the system as a whole, that actually we've got a cost of living crisis, so people are thinking more than ever, right, we've got to keep that heat inside. The worst possible thing you can do for mould is to have all of that heat inside without opening a window occasionally. So from a really practical perspective, actually I suspect this coming winter may be worse than ever. So again, and there isn't a simple solution to that, but I think, you know, all of us would have seen that shocking situation, and you know, thank goodness it was at Medway, and all of our thoughts, of course, are with the family up in Rochdale professionals that will be dealing with the fallout from this as well. And I welcome the strong reassurances of that kind of cross-council, cross-organisation working, and that's actually really important. And again, it will be for professionals across the board who now will probably have this on their checklist, where perhaps it wasn't even last week. And if any good can come from this tragic set of circumstances, it's that. On the wider issue of engagement, I agree. I've been lucky enough to be at a couple of child-friendly Medway events. I didn't partake in any fairground activities. I would have definitely embarrassed myself. And actually, you're right. It's seeing the people that are coming to those events genuinely from across Medway. It is a pretty inspiring thing, and Amy and the whole team, and it's the whole council team who are dedicated to that, I think is a positive thing. I have a differential of views around whether it should be the UNESCO version or not, but we'll have a conversation about that elsewhere. But I think that's a good way of getting some more voices into the mix. So thank you very much.
Thank you, Vince. Anybody else? Well, thank you, Leanne, for presenting this report. I'm always mindful of, it's in the summary, but although it talks about including children's services, health, police, schools, and voluntary and community organisations, and being part of that myself when I'm not being a Medway councillor, I think the voluntary and community sector is a very important part of any area in which we might live, and particularly here in Medway. But what I will share with you is a short tale, if I may, and this goes back to last Friday evening, where the Rotary clubs of across Medway hosted what is called the Rotary Youth Speaks event. And it's an opportunity for young people between the ages of 11 and 17 to actually talk about a subject that they choose. Nobody tells them what they're going to be talking about. They are the ones that make the choice. And a 13-year-old actually chose to speak about sea cadets. And to some in the audience, I could imagine what they were thinking, that they were really wondering exactly what was going to be talked about. But when I heard personally this young person talking about her life as a sea cadet, it was absolutely incredible. This young person spoke with such enthusiasm and spoke very much from the heart of how she, as a sea cadet here in Medway Town's Sea Cadet Unit, was having enjoyment, was learning new activities, new skills, making new friends, but all of this was being guided by adult leadership. She then went on to explain that this adult leadership all came from the voluntary sector. Nobody was there because they were being paid to do a job. They were there because they wanted to be involved and to help and guide young people. And I thought how right this young person has really got it. At the end of the event, the lead judge gave a resume of what had happened during the evening, always making that observation that this was a general overview rather than homing in on particular speakers and the subject. But he then added that I'm going to break with the protocol and say that the one item, the one speaker that we had this evening, last Friday, really did capture the imagination of so many when she spoke about sea cadets and what she's achieved from that being involvement. He then concluded by saying, unfortunately, because of my age, I'm too old to be a sea cadet. And before he had a chance to move on to his next sentence, this young lady immediately jumped in and said, well, you could, of course, be an adult leader, you know, much to the amusement of the audience and those in the hall that listened to this. But that was the view of a young person, and I thought that young person has really said it really for all of the young people across Medway who are involved in the voluntary sector. And as I say, somebody who is involved when I'm not being a counsellor, I've always agreed that if a young person wanted to move from, say, the scouts to the cadets, or the cadets to the scouts or to the guides, whatever it may be, I would always encourage that young person to go where their heart really felt they ought to be going. So thank you, Leanne, for this report. The recommendation is outlined on page 144, which basically says the Health and Wellbeing Board is asked to consider and provide any comment on the plan as set out in Appendix 1 to the report prior to it being presented to Cabinet for consideration. Is that agreed, please? Agreed? Thank you very much. Thank you. Right, we now move on to item 8 of the agenda, which is the Medway Safeguarding Children Partnership, the MSCP, the annual report for 2012-2022. And I believe this is going to be presented this afternoon by Rory Patterson, the MSCP Independent Scrutineer. Is that correct? Oh, it's Rebecca. Sorry, Rebecca.
That's okay. Thank you so much, Councillor Brake. So thank you very much, and thank you for taking the time to read this. So the report is being presented to this board with the joint working protocol that we have in place with Medway, and the report is also going on to the next Children and Young People Overview and Scrutiny Committee and the Community Safety Partnership. and this is the third annual report of the Safeguarding Children Partnership in Medway, and as you've said, covers April 21 to March 22. Hopefully you've had a chance to read the foreword by Dr. Leanne Farrock, along with Dame Eileen Seals and our Assistant Chief Constable Tracy Harmon. Just wanted to bring your attention to some key areas of the report, so that those areas to highlight, and the first being training, because one of the ways in which the Safeguarding Children Partnership here in Medway is able to influence the effectiveness of safeguarding is through our multi-agency training offer that we run for professionals and volunteers working with children. And I emphasise the volunteers, Councillor Brake, because we do indeed get a good uptake from that training from the voluntary sector, which is very reassuring for us because we want to work collaboratively with the voluntary sector. And last year we ran a number of virtual training courses which were attended by just over 550 delegates, and additional 368 delegates attended conferences and learning events during the last year. And we saw a huge increase of professionals accessing our e-learning platform, over 45,000 e-learning courses completed by delegates across Medway, which is a significant increase on previous years. And of course, we've returned to an element of face-to-face training as well, which has been available over the last year. And another area to just bring your attention to is that of neglect, which has been a key priority for the Safeguarding Children Partnership, because we know that this has been something that features in a number of the cases that we have reviewed. And we have a whole multi-agency response to neglect. And indeed, we've published our neglect strategy during the last year. And I believe that was circulated after one of the last Health and Wellbeing boards that I attended, as that was a request. And thanks to Stephanie for circulating that to the board members. We also had a neglect conference which we held and hosted, and indeed we've trained over 300 professionals across the partnership with the graded care profile tool. And also case reviews and audits. So we undertook 2 rapid reviews within the year, and also have had some very positive feedback from the National Child Safeguarding Practice Review Panel about the quality of our rapid reviews, which is to note. We have a very vibrant and well-attended multi-agency audit group, which all our partners have found very valuable, and we're able to share the learning across the partnerships down to operational staff, with the sole purpose of that impacting our quality of practice across the multi-agency partnership. The forward then goes on to look at key achievements, which I hope you've had a chance to look at. And I have Rory Patterson sitting alongside me, who is our independent scrutineer, and we'd be very happy to take any questions if there are any. Thank you.
Thank you very much, Rebecca. And my apologies for getting it wrong that you were presenting. And of course, Rory is here to give you support and answer any questions there may be. So thanks, Rory, for being with us this afternoon. Yes, Vince did say that at 4 o'clock he had to pull out. So I'll kick off then. And sorry, James, go on.
Thank you, Chair. Just one point, and maybe just to Rory, given the conversation that we've just had around housing, albeit it wasn't an issue that we would want to or had really tabled for this evening. But from your perspective, and looking across the work that you do, not just within Medway, that issue of the grip on housing-related issues and the risk factors, do you believe that we've got the ability to respond effectively should any of those issues start to be more prominent within Medway?
Thank you, Chair. Just checking my mic's working. Yeah, I mean, that's a really difficult question for me to answer, James. I've got a couple of views on it. What was interesting about the report on the the 2-year-old was an issue about partnership working. and sharing of information, and it highlighted a feature there in relation to health visiting, I believe, midwifery, GP practices. And this comes through in the work that I've been doing in Medway in Kent. There's maybe more work to be done in terms of how we can share information more effectively across agencies when children are very young. And this has come through in one of the reports I've highlighted here, The Myth of Invisible Men. Similar sort of theme. So, I mean, I've encouraged the partnership to pick up on that particular aspect. So you'll notice in the report there's a very good Section 11 process that's undertaken by the partnership jointly with Kent. So within the framework in which it has to be undertaken, it's a good process. There are lots of things I'd like to see change, but the way that Medway and Kent implement it and work together on it is really impressive. But when it comes to the question of information sharing, and you look at the audit returns, there's a lot about how we're very careful about making sure that information isn't shared. Whereas actually when you look at serious incidents, it's about information, the lack of information being shared. So there's a really important point there for the partnership as a whole to reflect upon and think, well, how can we address this? And I was fortunate enough to be meeting with the accountable officers, that, the chief executive, the accountable officer for the ICB, and the police inspector, to talk about this very issue. And they're very keen to see, what progress they can make in terms of improving upon information sharing at the very sort of early stages of statutory agencies being involved with children. So, I think there's the partnership as a whole is really quite strong. I think there are issues about turnover at a senior level, which has sort of held it back a little bit. So I've been here 3 years, and there's been a complete turnover of people at the top. But impressive leadership overall, and it's a bit about giving it time to bed in, and I've got no concerns about that really getting to where it needs to be. But I think ultimately, one of the challenges is that there's a tremendous amount of activity, a very good substructure, it's an inclusive, very inclusive partnership. It's brought in head teachers, which I think is creditable and best practice. But there's a weakness in terms of impact of the activity, and I know that's something that the partnership is very keen to develop and improve upon, for the forthcoming 6 months, year. But overall, I think in Medway you should take assurance from the position that you find yourselves with a new partnership. I think it is a strength. And I think it will go from strength to strength with the commitment. It's got the full commitment across all partnership agencies. And as I said in my report, probably the only area where I think they could be doing, being more inclusive is in terms of the third sector, getting more of their engagement in terms of maybe shaping the agenda going forward. But otherwise, a lot to be proud of locally.
Do you want to come back, James, on that at all?
No, that's fine,
Okay.
thank you.
Rory, could I, sorry, through you, Rebecca, because you're the author of the report, but I was interested in the point you made about the change in the organisations and the people that, really the people at the top and that high turnover. Did you find any evidence of, whilst there been turnover at the top, were there succession plans in place such that when somebody did leave, there was immediately somebody there who was going to pick up that work and who was knowledgeable enough to be able to continue it forward, or were there gaps in the system, please?
I think overall it worked pretty effectively in terms of replacing senior people who had left. I wouldn't say it was well, to call it a high turnover might be overstating it, but I think what it did was it slowed the progress a little bit. But as I said, I think we've got the right people, the right experienced people in. They've managed that change process, and I feel confident that with ongoing stability, that the partnership will go from strength to strength. So no, I wouldn't say there were any huge gaps in terms of sustaining the commitment. But I'm a believer in leadership and having strong and effective leadership, and I think when you get those interruptions, it does have an impact on what goes on beneath. And I think there were some turnovers in middle managers as well, particularly on the health side of things. I've worked with a lot of different people that have been there and gone, but I'm optimistic that things will settle down now. The sort of larger changes have been bedded down, and then we can start to see some real progress in the partnership.
Oh, thank you for that. That's interesting comments that you made there. But I think the other point that I'd just like to pick up on, and that is that obviously the pandemic that really did rule the roost when it came to safeguarding of children and families and so much more. But interestingly enough, one of the things that has been found that post-pandemic, organisations such as the Scouts, for example, have found that whilst they all kept in touch during the pandemic, they weren't able to have their weekly meetings for whichever section it may have been, they all kept in touch. And the interesting thing to Scouting is that the pandemic, we're now well and truly coming out of it and seeing the benefits, but Scouting has actually seen its numbers grow in numbers from the youngsters who weren't there and couldn't meet to now they're coming back and they're bringing their friends with them. So Scouting as an organisation, in fact, has actually grown, which to me is a good sign. We just got to make sure that the leadership keeps track with the number of young people coming. So if there's any volunteers around the room who feel that they'd like to give up, it's only one night a week. That's what I've been peddling for years. But it's one night a week, and you get so much out of it and helping children. But no, thank you for that, Warren. Vince, please.
Thanks very much, and apologies for missing the start of your item. You can blame Jeremy Hunt for that. I thought we're in a good place with the report. I wanted to explore. I'm quite a fan when let me rephrase that. I'm not a fan when stuff goes wrong nationally, but I think it's a very powerful tool to be able to say, actually, this is something where there could be an improvement. Let's look at this. And I know one of the recommendations potentially was around the role of the missing parent and the missing man. And I wondered whether, at this stage, if you think there are good examples that Medway, the place, so the three main partners, plus actually the voluntary sector, which I'm sure will have a key role in this. If you think there are good examples at this stage of places to be shone a light on as to those who have made good progress on this issue, it is something which is often talked about as one of many items when you're looking at various issues around safeguarding. So I wondered whether there was good examples, and actually what, if you can expand, if you are in a position to expand on that, in particular, what positive outcomes have come as a result perhaps of partnership working, looking at that specific issue, because it is one which I think many people have talked about probably for 20, 30 years, if not longer.
Yeah, a very good question, and I was doing a bit of work on this for across Medway and Kent, and I looked up some old reports on this very issue. I think it was the Department of Children, Schools and Families produced a report going back. I'm not quite sure when that was, but it highlighted the same point about the engagement of men and was really making a strong case for that. Then we had Ofsted in about 2013 did a thematic report where again they highlighted the fact that men weren't being engaged. A lot of men wanted to be engaged from a number of aspects. One is potential risk. So people weren't identifying there was this male partner, the father of a child, but also how men might be able to support, what support they can bring into a new family and the paternal extended family. So I think the reality is that, you know, I've contacted a number of areas and they said, well, you know, I've heard you're doing some really good stuff here, and it's all been quite limited. So I would say there might be places out there, but I haven't come across them where I think they've really managed to get to grips with this for lots of reasons. Now, having said that, in Medway, you know, they've got the ICON project, which has been rolled out across Kent, and they're looking at ways of engaging men more proactively. I know there's some good training programs that's been set up in Medway, a lot of awareness raising, so people know the value and importance of it. I think that the challenge is what's the most effective way of doing it, and at the moment, there aren't the metrics there to enable us to see what difference it's making, so you can't see what the impact is. So, for example, and maybe Rebecca might have something on this, it's the, you know, attendance at child protection conferences by men or involving them in that. That would be one indicator of, you know, getting men more involved in the process. So there are a number of things that are being undertaken, but I think it needs a bit more of a sort of culture change and really grabbing hold of the issue, and also building in, you know, what do we expect to see as a result? What are the metrics that tell us we're making a difference? And if you look at the you know, violence of children under 1, you know, it's about 75% of those incidents are due to men and down to men. So you can see the importance of, let's really try and engage with men at an early stage, and it will probably also have an impact on the numbers of children that ultimately come into care if we can sort of identify risk, but also strengths, and build on that.
Is there anybody else who would like to say anything? Rebecca, did you want to sum up at all, please?
Thank you to everybody, and we would just welcome you to accept the report, and obviously it's ongoing to the 2 other destinations. But it's been, I think it's been a valuable year, and a year that the partnership has really built on the strengths of its leadership, and particularly its subgroups. I think we're fortunate in Medway to have really good partnership commitment at our subgroups, and that certainly makes a difference to how we are able to sort of move forward with our various strategies and commitments as outlined in the report. Thank you, Councillor Brake.
Thank you, Rebecca. Thank you all very much. I move that, in accordance with the recommendation, the Health and Wellbeing Board is asked to consider and comment on the annual report and the effectiveness of local services in keeping children safe. Is that agreed, please? Thank you very much. And thank you, Rory, for being with us this afternoon. The next item on the agenda is item 9, Making Every Adult Matter, and that can be found from pages 201 to 208. Dan Hill, Partnerships Strategy and Public Relations Team Leader, will introduce this item. Pardon?
Thank you, Chair, and thanks everybody for having me. So just as a brief introduction first, Making Every Adult Matter is affectionately known as MEAM. And Dan, if you wouldn't mind skipping forward 1 slide for me. So MEAM is a national coalition of a range of charities. Apologies those who are sitting with their backs to the screens. So those charities include Homeless Link, who represent homeless services across the country, Clink, who represent criminal justice, Mind for mental health, and also associate member Collective Voice. So MEAM represents around about 1,300 member organisations now, crossing over 42 areas within England. So we were approached early June by MEAM, who had recognised that Medway had a particularly strong network of partner organisations, voluntary sector services, and encouraged us to put in an expression of interest for Medway to become a MEAM network area, which we did. And for that we gathered support from a range of Medway Council services, stretching housing, public health task force, and also the Community Safety Partnership. Also NHS, Kent and Medway Mental Health, National Probation Service, and, as I say, numerous voluntary sector services, commissioned and non-commissioned housing-related support providers. And then shortly after that, we were invited for an interview. We were supported there by the Task Force, Probation, Mental Health Services, and also One Big Family. And then finally, on 7th of September, we were made aware that we'd been successful. So if you wouldn't mind, please. So what does this mean for Medway? So what it brings for us is a dedicated critical friend and support from MEAM. And in particular for us, it's a gentleman by the name of Greg Headley, who will help guide us using the MEAM approach to improve services and systems. It will give us access to a wide range of learning and networking opportunities with the wider network and include regular strategic lead and frontline practitioner forums, learning hubs and conferences. It'll also give us access to a set of core training for key staff, including introductory sessions around co-production, co-design and co-delivery, and systems leadership, and then importantly in something that's close to my heart, trauma-informed and strength-based approaches. We'll also have more opportunities for networking across the broad network, including access to an online portal known as the Mighty Networks platform. We'll also have access to focused intensive support to tackle specific systemic issues with opportunities to enable comparison across the broad network, learning from best practice, and also the learning generally across the country that has happened over the years. I should also say, MEAM's been established for well over a decade now, so it has got a lot of experience behind it. And then finally, also opportunities to share learning and inform national policy. Next slide, please. So up on the screen for those who can see it right now are some highlights from the MEAM annual report, which was released in October this year. The three main areas that it focuses on within the report is individual wellbeing and support, efficient use of resources, and people, services and systems work for and with people experiencing multiple disadvantage. So moving forward, MEAM's future programmes and evaluations will now turn to understanding the systemic factors that are present in successful teams and local systems, so that these again can be spread across the country. And this includes focusing on the cultures, narratives, leadership, co-produced partnership infrastructure that are ultimately the hallmarks of successful systems and that are vital to leading change. So, next slide, please. So MEAM has received funding to work with Medway for 2 years. The commitment locally is for Medway to provide a full-time post for that 2-year period with sufficient seniority to manage the engagement and the associated activities of the Medway MEAM approach, which is formally the title of the programme, the Medway MEAM approach. We will build on the already established and celebrated local partnerships that the project will complement and actively contribute to, which includes the Medway Blue Light Project, the Vulnerability Panel, and the RSI Complex Needs, that's the Rough Sleeper Initiative Complex Needs meeting, just to name a few. And with the support of MEAM, we and the Medway MEAM Coordinator will set up and maintain ongoing operational and also strategic panels. If you could go to the next slide, please. Not that you can see this, and I have thrown this slide in as an addition, so apologies, I'll make sure that it gets sent out to everybody. And I didn't recognise that it would be so difficult to see. But as I say, I will make sure you get it afterwards. So the strategic panel will explore any areas that are identified as systemic barriers or blocks. where joint working can be strengthened, and also to develop and support approaches to improve the processes and activities that we require to ensure that we're delivering to those that face multiple disadvantage. We'll be using the national examples of good practice and bring on board more stakeholders and also improve the current partnerships that we already have. And again, this is with a focus on the outcomes for people who are vulnerable and who also face multiple disadvantages. And then the strategic group will feed into that operational group. And again, this small flowchart or process map will show you this. To carry out these activities and to facilitate specific individual interventions for that target group, which includes those who are not part of the blue light projects, Medway vulnerability panels, rough sleeper, complex needs meetings. So, next slide, please. So, I mean, what we need to keep this project moving forward is ultimately assistance in identifying those key contacts, who we need to help us unblock any progress or processes. We are seeking support with staffing for the project, as we've got this commitment to provide a Medway coordinator. We're asking for assistance in sharing the Medway MEAM project goals, plans, and also outcomes. And finally, to understand what this group needs from the Medway MEAM project itself. And next slide, please. And in looking at the strategic objectives for this board, the MEAM steering group believes strongly that our strategic objectives are aligned, and in particular around the inequalities, addressing inequalities, combining of resources, sharing best practice, and also lessons learnt to improve outcomes, not just for the MEAM target group, but for Medway as a whole. So, next slide, please. Our progress to date. So we've got terms of reference drafted for the operational group and also drafted and agreed for the strategic group. The strategic board meetings are in progress and we meet formally the first Thursday of every month, and also as and when required. We're working tirelessly at the moment to get the relevant documents together and the just forward momentum to be maintained. We have the MEAM coordinator job description agreed. Action plans are agreed and actively being worked on. We're engaged with other MEAM partner areas in a variety of ways, but also including that Mighty Networks platform. We're attending the MEAM training, and importantly, we're currently carrying out some partnership analysis with partners of the target group themselves, identifying the indicative baseline impacts, costs, and working collectively to agree the target outcomes, including reductions in reliance on statutory services such as A&E, and cost reductions in other emergency interventions, with the overall target of increasing the length of life and the opportunities for people facing multiple disadvantage. Our primary client group is individuals who are at higher risk of premature death, and who the current systems that are in place are not able to progress those individuals. Thank you very much.
Thank you, Dan. That was a very informative presentation. Thank you very much. It appears to me that you've hit the ground running. And so well done to you and the team. What is the actual size of the team, please? Give or take 10 will do, you know.
So, yeah, 10 would be nice, Councillor Brake. So in terms of our overall team that lead our strategic, a big chunk of our strategic direction in terms of housing services, we probably have in the region of probably 4 or 5 posts that are doing a whole range of things that include, you know, developing housing strategy, looking at policies and procedures, doing various activity of, you know, commissioning and various things. we don't have a dedicated resource for this project, essentially. So for the MEAM project, we don't have a dedicated resource. So that's something I'm working hard to identify within my existing budget. We've been talking to James around whether there is any public health funding that is available to help us build in a resource. But we are, to a degree, asking agencies and other partners as to whether there is any other funding that we can tap into that will help us support this project. Because I believe it's really crucial for Medway. You know, we've been on a bit of a journey, and I know Vince doesn't like that phrase, but we've our rough sleeping, the position for Medway in terms of where we were back in back in the winter of 2017-18, we are now, we've done such a significant amount of work, and we are now ready to take the next step as to how we become, a really, a leading player kind of across the country, and this is really integral to that. So we will find a way of supporting it, but anything that anyone can do around the table to help us do that would be fantastic.
Thank you. And I linked in with Dan a couple of weeks ago in relation to this project, because actually the work that they're doing significantly or will significantly impact on health. And we've got some resource within our team, and we've already sort of started those conversations about how we can show the benefit to the health system, so how we can start sort of doing that mapping and the cost calculation, so that we can see how we can potentially sort of support funding for this through health inequality going forward. So that work is in progress at the moment, and from a PHM point of view, we're fully supportive of this programme.
Thanks very much. And it's the second time I've seen the presentation just as good the second time round. And it's worth saying, actually, that was in the CSP. And actually, I think the fact that it's been presented there and here just shows the kind of service cutting through approach that this programme will take. And it's a phrase I would always want to use more, but actually, even if you had zero compassion and only cared about the bottom line of organisations, this is the right thing to do, because, as the slide said earlier on, a reduction in A&E, a reduction in other interventions, but actually everyone around this table actually has compassion and actually will want really good outcomes for those really challenging individuals. And I know that lots of officers have had experiences in other organisations before they came to Medway, so they'll bring all of that expertise and knowledge along with the partners across Medway. So I really welcome Nikki's comments there as well, because actually it's around the system as a whole, recognising that this is a way to make a further step in that journey. Mark's right that 6 years ago, the homelessness situation, and this isn't all about homelessness, but there's a clear link in with that. We were in a terrible place for lots of different reasons. We're now certainly not in a terrible place, and the fact that during COVID, MHCLG recognised Medway as an exemplar with the Everybody In programme just shows that positive journey. There's always more work to be done, and actually I think part of why this programme is important is I'm genuinely hopeful, and time will tell, is actually lots of what's happened has been sticking plaster, albeit sometimes sticking plaster that's been there for a while. We need to try and stop people being in this process to begin with, and actually through the work that will happen with this programme, I'm convinced that will be the case. So absolutely welcome this, welcome the fact that actually partners are looking in and already wanting to contribute, because ultimately that will be good for taxpayers, but more importantly, good for those individuals who are at the heart of this programme.
Thank you, Vince. James, you wanted to comment?
Just very briefly, and just to echo some of the points that have already been made, this type of initiative is what this board is about. It's about those people who are more vulnerable, disadvantaged, and clearly Mark is hiding his lights that the comments through COVID. I think I'd double down on those. It was fantastic work that we did within our patch, of course, at a partnership level, and we brought that up to date. I know the team is still working, and particularly with this cohort around the COVID stuff. I'll come on to a little bit more about that, but you're doing that homeless piece, bringing in the vaccine bus up into Gunwharf, so really well done, Mark. And again, Chair, the presentation was given at the Inequalities Prevention Population Health Committee, where we were talking about the impact of the wider determinants, and this type of approach was where we got that cross-cutting theme, the impact that Nick has just talked about in terms of the interface with the NHS. And actually the key point is, if we don't do something with these people, unfortunately they will end up one adverse event, so they'll end up unfortunately potentially passing, but actually the service utilisation, all the other things that we can do upstream is why this programme is such a very important piece for us as a board to consider. And of course Mark knows that from my perspective, and please Nikki to hear where you're coming from as well, that we want to engage and to support so this thing can be sustained, Chair.
Thanks for the presentation. I was really struck by the slide around us from strategic leaders, and I was really pleased to see that one key context for unblocking, because I'm a great believer in unblocking and unblocking really, really quickly. I think it went out of fashion for a while, that whole unblocking, but I think as a system, you're right to want to, identify key contexts for unblocking, because it can't happen tomorrow or next week or the week after. It's got to happen pretty quickly, in my view, within 12 hours. I always try when you've got vulnerable adults and children at the end of some of this work you're trying to do. So you've got my name. There it is. Children's or adults, anything that's, needs unblocking, email straight through and I'll get onto it. Yeah, that's my commitment today. Thank you.
Thank you, Leanne. Martin, would you like to come in, please?
Yeah, thanks, Chair. Similar to other comments, so there was a great presentation and a great project. And some of the outcomes are excellent. I suppose I had two questions. Nikki's answered one, because one question was for Nikki if the team are aware of this project. So that's a simple one. I suppose the second one is around sustainability and ensuring that we don't focus just on 2 years, but how we bring this as part of going forward. So I'll be keen for those discussions to take forward in terms of, as a system, how do we do this on a longer term basis? So obviously I understand the need for a full-time project manager at the moment, but I think there's the opportunity to really build this into the way we deliver services and coordinate that. So again, I think just linking with Nikki, from the NHS perspective, how we take this forward as well.
Vincent, please.
Thank you, Chair. And Dan, thanks for the presentation. And as James said, we saw the presentation as well at the Inequalities and Population Health Committee. So I just wanted to comment from the Integrated Care Board perspective in terms of really responding to Martin's question about how do we link it together in terms of some sustainability. So clearly there is good evidence from pilots like this around the outcomes, and really important that we are focused on how we can improve life expectancy as well through that additional investment into prevention and what else we can do as a system around prevention. So I wanted to make that link because, of course, one of the things that we're currently working on is the development of our integrated care strategy for the Kent and Medway system. And the delivery of that strategy will absolutely be focused around how do we work together at a place and neighbourhood level so that actually we can tailor our interventions to meet the needs of our local populations. So from my perspective in the Integrated Care Board, it's really important that we also demonstrate how we are working differently. And how we'll be working differently in this, guys, is about ensuring that we can allocate resources that come into the central commissioning functions that we have out into our local health and care partnerships. And that, in essence, is one of the early decisions that we've already made around the recurrent funding that's allocated to us for inequalities. And again, 80% of that funding will be allocated to health and care partnerships to support the work that Nikki's described. It won't enable us to do everything. There are real challenges, of course, that we need to recognise, but it is a starting point. And I think having the evidence from pilots like this in terms of the outcomes they deliver and the need that's prevalent in different places creates that business case for that sustainable investment. Thank you.
Thank you for that, Vincent. That's interesting. Any other points? No. Well, look, it falls to me to say to both you and Dan and Mark, thank you very much for the presentation this afternoon. Thank you for answering the questions quite openly and frankly, which is something that I always appreciate and encourage within the Health and Wellbeing Board. But as I said, you've hit the ground running. We wish you well. And you will be invited back to give us a progress report. I think we'll probably leave it a few months so before we do that. Give you time to settle. How's that? Very generous, very generous. But thank you all very much for that. There is no recommendations to that. It was a presentation and we're most grateful. Thank you. Final item on the agenda is item number 10. Which is the work programme. And for this one, I'm going to hand over to Stephanie, who's to my left. And Stephanie will take us through the work programme, please.
I don't actually have anything to add, but we do have James here who's going to go through a number of the appendices that were attached to the report. There's a briefing on the Medway Council Health Determinants Research Collaboration Appendix 2 that James will talk through, and then he'll then go through the briefing on the COVID-19 management plan, as well as a verbal update on health inequality. Okay, that's fine. James?
Thank you, Chair, members. So I'll touch first on the Health Determinants Research Collaboration. Little notes there in the reports. Really good news. We reported our bid in April, and this is a partnership bid. Everyone in this room, all the organisations signed off and helped us achieve that. So we've now been given the green light. So we've started from October. I signed the contract last week, I think it was. So finally, before the announcements today, hopefully. So that's all secured. So what that basically does, Chair and board members, is give us through to October next year some development resource, help us to firm up, do recruitment alongside the University of Kent. So we've got the appropriate people in train. David Whiting is the research director, so he'll be looking after the programme. And of course, all members are aware of David and his capabilities, so we're in safe hands. And then from October, we have got 5 years worth of funding that totals in around £5 million to retain. And then, as Martin's just said actually about the previous item, make this sustainable. This is about transforming the way in which we as a system can now identify issues, and we've just had one about, you know, the MEAM project, but there are other issues. You raised a few about the households and stuff. These are the kind of topics that we can pick up, put proper research evidence into, and come up with some solutions for Medway. So just to give board members that assurance that we've now been given the green light, we've got the resource, and we will start then to develop our research capability over the next sort of year through to October when we start proper. I'll take any quick questions on that, Chair. Thanks. Second point then, just a brief one on COVID, because I always do this, don't I? The paper's in there, it's a little bit dated, but our rates have reduced, and just in terms of where we are currently, so 26.9 per 100,000 in Medway, Kent rate's 35.6, South East 37, and the England is 36.4. Normally, anything under 25 per 100,000, I'm happy at. So we're near enough there, and I would suggest that we're going in the right direction. What we've also got to guard against is complacency. You heard the comments earlier with our housing colleagues, because we do need to get the vaccination rates up, particularly for those who are eligible for our the winter-autumn booster. And so we are working in partnership with our ICB colleagues in NHSE and obviously Martin's team as well to identify folk to work proactively. So that's why we've got a mobile bus that's going out to people. And even though it might be 5 year, 10 there, then actually they're the people that we need to get, because it's in our more, unfortunately, in our disadvantaged communities where we've got the lower ascertainment level. So COVID at this moment in time, I am I've got my eye on it, but I'm not flagging any major issues with us at this moment, just preparedness. And running concurrently, of course, is flu vaccine, and we need to make sure that people make themselves available. If you haven't already done it and you are eligible, so I think it's only 55-year-olds, get a needle stuck in your arm as quickly as we can. So on COVID, that's where we are with that one, Chair. And then the final point, Vincent's touched on it, but I do want to just give the board assurance around the work that we are doing as a system, particularly in terms of the cost of living challenges that we are all facing. So just from a Medway specific perspective, and then we can expand up. So within the council, within CMT, across all of our divisions, we've been working to see what are the things that we've got available. We've got some resource in terms of a specific fund. That's all the household support fund that enables people to bid against that. But we've also got other opportunities that people can access. And I convened, we've had a number of discussions. I've done a paper, but within the council's corporate management team, we convened a meeting, I chaired it this week, just to look at where we currently were in relation to coordinating all of that effort and looking forward into the next sort of 3 to 6 months as to where we are. We were waiting to see what would come out of the announcement today from the Chancellor. So now we've got that. We're going to reconvene a meeting again next week to then firm up any additional actions that we might need to take. But just the reassurance from that perspective, at a system level, that we had this symposium the other week, and the inequalities piece and the way in which we need to focus on some of the challenges which are about the wider determinants. It is about those children who are vulnerable in families, and also older people who are at home, not able to put the heating on and those types of things. So we are coming at this from lots of different angles, but just reassurance as a board, we are on it. We're still clearly trying to make sure that we can second guess some of the stuff that would have come out from government. We now know what that will look like, so we will look again at this, Chair, and tailor our response accordingly.
Yes.
Just thank you, Chair. I just wanted to say I'm grateful to James and the team for that coordination around Household Support Fund. I think it's really, really important that we reach those vulnerable in Medway, and I have every confidence that that's happening. I just wanted to say at the Medway Education Partnership Group this morning, head teachers have now stood down COVID as a regular agenda item. They are assured that you and your team, James, and others are working well with them, and that schools will be dealing with COVID on an exceptional basis. So, thank you.
Well, it sounds like a... Yes, Vince.
Thank you very much. Just one more before we all get out of here. Thanks to James and Leanne for those updates. I think that's important. I just wanted to check with the comms, and this is comms for everybody, not just council comms, that the message around, even if you've not had a jab yet, you can still come forward, is out there and loud, because actually it doesn't feel, certainly on social media, and I probably need medical attention for my addiction to social media, but that's another question for another day. It doesn't feel as if that's out there. Now, it might be that the algorithms go, you've had all your jabs, including your booster, including your flu jab, so you're not going to get to see this. I hope Mark Zuckerberg and Elon Musk don't know that, but who knows? But it's around trying to make sure that those messages, not just on social media actually, but in Medway Matters, in the Medway Messenger, which is still taken by lots of people, that message around actually, if you've not had one jab, you can still step forward for it, because I think we shouldn't... Leanne is right, it's not as much of an issue as it was 18 months, 2 years ago. I think we all accept that. but it's still an issue. It's still impacting. It's still, people are still ill with it, and in some cases very ill. So just wanted to get a sense, and I can see lots of nodding heads, so that gives me lots of confidence around that. So just primarily around that message, loud and clear, that actually, even if you, for whatever reason, haven't had your first jab yet, you absolutely would be welcomed with open arms and a needle to come forward. Thank you.
Thank you for that, Vince. Actually, I was going to conclude on what I thought was an extremely good message that's coming across. And whilst you're saying we'll have your discussion concerning you on another day, well, I don't know about anybody else, but let's have it now, shall we? But I jest, Vince. But the fact is, I think that communication is out there, and certainly the surgeries are certainly doing their part to make sure that all of their patients are advised of what is available, what is required. And I was going to finish really by paying a tribute to the services that have been providing the vaccinations, in as much as that I had an appointment for a flu jab. They had me down in the chair, and I felt as though afterwards I'd been a captive audience, in as much as that it was them that reminded me that I was on the list, and for a further COVID booster jab. Although at the time I was still waiting for details of the appointment to come through, my wife having already had hers come through. And I thought this was so efficient, and the truth is, as I sat in the chair, I was tended by two nurses, one who put a flu jab in my left arm, and at the same time there was another one to my right who gave me the COVID booster number 4, I think it was. So I came out of there, two arms, thinking, what on earth have I done? But I felt it was very efficient. They were very keen to pick up on people. And so long may it continue as is necessary. And thank you, James, for keeping an eye open for us right across the whole of Medway. It's appreciated. Well, I think, are we agreed to the work programme and reports as presented? But Vince, did you want to? Vincent, you want to?
Just to thank you, Chair. Just to add one additional thing, if I may. So there is a requirement for the NHS to produce a 5-year forward plan and to consult with health and wellbeing boards around the development of that plan before the end of March of next year. So I just want to ask to add to the work plan for the February meeting so that we could bring that back to the health and wellbeing board.
That's fine. Thank you very much. There being no other business, I declare the meeting closed, and thank you all very much for your contributions this afternoon. Much appreciated. Thank you.